Welcome back to Angel Winnie Lesson Tutorial. In this video, we are going to study about the psychiatry, in that functions of psychiatric nurse in various settings. So there is a functions will be there for the nurses in the various settings of psychiatric field. Okay, so psychiatric nurse means we will think about that. Okay, it may be only in the psychiatric hospital, but it's not like that. They have the functions, psychiatric functions in various settings. So that all the things we are going to study in this video. Here, first one is the inpatient psychiatric ward. Okay, so that we have the functions of the psychiatric nurse we have list down here. So we will see one by one. In that, first is inpatient psychiatric ward. Second is psychiatric outpatient department, and third is ECT treatment settings, and fourth is psychotherapy unit, and fifth daycare centers or daycare hospitals, and sixth family therapy units, and seven child psychiatric ward, 8 home settings, 9 community mental health centers, and 10 hospice care centers, and 11 emergency department, and 12 medical inpatient ward, and 13 industrial medical centers, and 14 hospital for criminal, insane, jail and prisons. So these all are the functions of psychiatric nurse in various settings. So we will study one by one what are the functions of the psychiatric nurse. Why? Because it may ask for the 5 marks in the exam. It's very important, the functions of psychiatric nurse in various settings. First one is the inpatient psychiatric ward. So inpatient psychiatric ward. So as we know, inpatient, the patient will be in the psychiatric hospital. So that we used to call it say inpatient. What is outpatient? The patient will be comes and they will go back. So that we used to call it is a outpatient. So here inpatient psychiatric ward. So what are the functions of the psychiatric nurse? Here first one is provide for environmental safety. Yes. See, psychiatric patient need the there are lot of injury, so they will get lot of injury in the hospital. So psychiatric nurse have to protecting from the other injuries. So that is they should give the environmental safety. They perform psychosocial and physical assessment. Yes. So psychosocial and physical assessment. Physical assessment, what we will do? So, same like the physical examination, all the physical appearance, everything. Is there any injury happen? What about the vitals? What is the condition of the patient? These and all we will do. And same like the psychosocial. So what about the mental health of the patient? So that also we will do here. And next one is a promotion of self-care activities. So okay, self-care activities means the patient, whether the patient can do their own daily routine properly. So that they will be assessed. So as a nurse we should promote them. Okay, make them to do their daily routine. Even they will bathing or brushing, all those things. Then medication management. Yes, we should be concentration of the medication, whether they are taking the medicine properly, or the condition of the patient, whether it is reducing or whether it is improved. Okay, so that and all will be comes under the medication management. As the same for the somatic therapy. Yes, what is the somatic therapy? Which will be giving the what will we say, that mind body related therapies. Okay, so which so patient or the people. Okay, patient means the person, he might have any stress, or he had any tension. Okay, because of that they may have the psychological problems. Okay, so that for that kind of things they will provide the somatic therapies, body mind stress relief therapies they will provide. And observing and documenting the patient behavior. So they will be accurately observing and documenting. Yes, it's very important, observing and documenting. So they will be observing and document the patient behavior. Participation in various therapies. Yes, so they will make the patient to participate in the various therapies. What are the various therapy? Psychotherapy will be there, behavior therapy will be there, group therapy will be there, family therapy will be there. See, they will make the patient to involved in these all the therapies and deliver the psycho education. So they will give the psycho education. So maybe like a test. Okay, how they can be. These people can be pass this exam like that. So whether you are agree, they will give the question whether you are agree, whether you are doing all those things. They can find out the status of the mental status of the patient, and that teaching social skills and stress management. Yes, if you get any stress, if you get any tension, so they will be teaching there. As a nurse. Okay, discharge and planning and community referral follow up. So what is that? So discharge planning. So when they are going to give the discharge, okay, hospital giving the discharge to the patient, so we should give the community referrals and a follow up. Okay, how the people, community people will be treat them, and they will give the follow up. They will be saying like that, you have to be like that, you shouldn't angry with them. So they will teach everything, and supervise the work of the subordinate. So as a nurse we should be supervised. You have to do this work, you have to do that work, like that we have to divide the subordinate works and maintain the ward cleanliness. It's very important. So hospital means we know it should have the tiny and cleanliness. It's important. So here maintain the ward cleanliness. So these all the functions will be coming under the inpatient psychiatric ward. So next one is the psychiatric outpatient department. Inpatient department we have seen. Next one is the outpatient. So what are the things we will do as a nurse? So here performing the clinical assessment. Yes, once the patient comes to the hospital, we will perform the clinical assessment. What are the clinical assessment? Like a physical examination we will do. Why? Because if the patient have any physical problems, like physical any, it may have any disease or anything. So we should be know whether it is physically healthy or not. Okay. So that as a nurse we will do the clinical assessment. Then assessing for the psychometric assessment. Yes, that is a mental assessment. Okay, so that is the mental status examination. Okay, so you have studied that what is that, a mental status examination. And so that is a psychometric assessment. Then providing the psychotherapy or behavioral therapy. Yes, so there they will provide the psychotherapy and behavior therapy. So what is psychotherapy? What is behavioral therapy? So we will study detailedly later. Okay, psychotherapy means which is related to the patient disease condition. Behavioral to change the behavior, all those things. Okay, so we will study detailedly about these two things. And counseling the patient and family members. Yes, so here psychiatric nurse, so they will give the counseling to the patient as well as their family members. Okay, so how to be cope up with the situations and what are the problems, so how they will face to the society, these all the things and all. They will give the counseling, conducting group therapy. Yes, they will provide the group therapy, delivering psycho education. Yes, they will provide the psycho education to the patient. So these all the things will be coming under the psychiatric outpatient department nurse. Okay, so next one is the ECT treatment settings. As I said, ECT means electroconvulsive therapy. Okay, so what is the this ECT? So ECT means electroconvulsive therapy. We used to call it as ECT. So ECT treatment in settings. So ECT, so normal people they used to say they are going to give a shock to the patient. Yes. So here he used to say as a nurse, okay, we are in the medical field and we have to say that is not a shock treatment, electric shock treatment. So we have to say it's a electroconvulsive therapy. And here they will provide the teaching the patient prior to the ECT treatment. Yes. So they will teach the patient. Okay, so we are going to give the this one ECT to you. So these all the things and we will do all the procedure. Same like that. When you are giving the injection to the patient. Yes, you keep the hand like that, and we are going to inject, or we are going to give the medication, or we are going to give the IV. Okay, all the things we should be say. So like same like that, they will teaching the patient and preparing the patient for the ECT. So what are the preparation they will do? Okay, simply they will send the patient for the ECT. It's not like that. Okay, there is a preparation will be there. Okay, so all the preparation they will do. They will give the this gown, and they will make the patient it is okay, and they will keep the tongue depressor, okay, over the mouth. Why? Because during the ECT, patient might bite their tongue, so they will keep the tongue depressor on the mouth. Okay, so these all the preparation they will do. Who? The psychiatric nurse, and providing the care during the procedure. Yes, during the procedure they have to give the care. Why? Because suctioning will be there. They have to suction it out. Okay, otherwise it may be wrongly go into the what? It is going to the trachea. Okay, so patient may have the salivation. Okay, during ECT. So that the nurse has to be suck it out. All those things, and assisting to post treatment. Okay, so assisting with the post treatment. After the treatment, have to give the care to the patient. Then providing the reasonable reassurance to reduce the anxiety. Yes, patient always have the anxiety, and they will feel very scared about all the things. And as a nurse, we have to give the reassurance. Don't worry about, we are here. Don't worry about, nothing will be happening. We have to give the reducing the anxiety, and give the psychological support, all the things. And delivering the psychoeducation regarding the ECT. The patient might not knowing that what is the ECT. So we have to tell the patient this is the ECT, and we are giving the electric convulsive therapy. This is a therapy we are giving to you, so you don't worry about it. We have to give the advantages. We have to tell the patient to advantages and disadvantages of the ECT. So all those things the patient should be understand. Okay, it's not everyone, we are not saying the patient is who is know to, or who can understand the this all the things, procedure, all the things, and who are conscious. Okay, not conscious, who is aware to understand all the things. So that is about the ECT treatment in the settings. Psychotherapy unit. Okay, so they are giving the psychotherapy to the patient. So in that psychotherapy unit means then they should have the some of the degree. Okay, so they should have the master degree in psychiatric nurse should have, and she should be have the certified the clinical specialist. Okay, so and she should be what, master degree in psychiatric nursing and clinical specialist, and she should know to conduct the individual or the group psychotherapy. Okay, so then only we will allow the patient to allow the nurse to do the psychotherapy, allow the nurse to work in the psychotherapy unit. Okay, next one is the establishing therapeutic relationship. Yes, should have the good establishing relationship with the patient. Nurse means so simply we are going and asking, okay, what is your problem, why, what happened, why like that. If we are asking like that, they won't say anything, and we should have the therapeutic relationship with the patient. The way we are talking, the way we are asking the questions, it should be therapeutically. There is a manner should be there. Interpersonal relationship. Okay, saying like that. Therapeutic relationship with the patient, and providing an opportunity for the patient to release the tension as a problems are discussed. Okay, so patient may have lot of problems. Okay, so they had lot of tensions, may have or kind of stress, whatever it is. So that all the things we should ask the patient, and patient will say their problems, and the release of tension as problems are discussed. That's why we are making the therapeutic relationship with the patient. And assisting the patient gaining insight about the problem. Yes, we should assess the patient what is gaining insight about the problem. So gaining insight means something it is there. Okay, so they won't reveal it. Same like that, your friends. Okay, something it is there, but they won't say that. So we will ask, and we will ask lot of questions. At last only we will come to know he had the problem with that. Okay, same like that. So we should assist in the gaining insight about the patient problem, providing opportunity to practice new skills. Yes, as a nurse, and we have to provide the opportunity to the patient to develop or new skill. They may have any skills, and we should be make the patient to develop their skills. And reforming appropriate behavior as it is occur. So reforming appropriate behavior, so they may had a good behavior before, and we should be take it out back. Okay, then providing the consistent emotional support. So we have to provide, as NS have to provide the consistent and emotional support. So these all the things will be coming under the psychotherapy unit. So next move to the daycare centers and day hospital. Yes, daycare center, it's not for the kids. Okay, so it is for only the patient. Okay, day hospital. So psychiatric patient, they can go to only the they can go to the hospital that only open for the daytime. Open only in the daytime. Okay, so here in day treatment, the patient return homes at night. Okay, in day treatment, they will provide the tablet and they will provide whatever it is, and they can go back to the home. And performing clinical assessment, they will perform the clinical assessment, as I said, when the patient comes now, so they will do the clinical assessment, that is a physical examination, and accurately observing and documenting the patient behavior. Yes, they will tell the patient to come. So maybe like if the patient comes today, they will tell the patient to come in 1 week later, or else 2 to 3 days later. Then they will come, like that they will assess the behavior of the patient. And the medication management, giving medication and teaching the social skills. Yes, social skills they will provide, and counseling the patient and family members. Yes, once, so as you know, okay, something happened to your family member, anybody, okay, they will give the family counseling to the everyone. Okay, they will call all the family members. Yeah, then they will say the thing. Okay, so like that, if anything happened like mentally problem, so they will give the counseling to the patient, as well as they will give the family members. And then next is the delivering psycho education. Yes, they will provide the psycho education to the patient, and providing the occupational recreational therapy. A lot of therapies we will be having: individual therapy, group therapy, psycho, what is that, occupational therapy and recreational occupation. They will make the patient to do something doing like what agavatti, or something like paper craft, all the activities, that and all kind of therapy they will give. And recreational therapy, games, okay, all the things they will give. So that is about the daycare centers and day hospital. Okay, so next we are going to say about the family therapy unit. In that, the family therapy unit assessing the individual and family needs and resources. So here they will assess the family. So whether the patient got disease, or whether the patient got the mental problem because of the family trauma or the broken family, so that they will assessing the individual and their family, and so that the nurse will be assist, and facilitation of a family's use of positive coping strategies. Okay, so they will tell them to use of the positive coping strategies. Okay, so if it is broken family, they will tell the family members, okay, how to behave in the family, or how to be in the family, what are the things. And as a psychiatric nurse, they will teach the family members. And next one is promote adaptive family functioning by teaching communication skills, problem solving skills. Okay, so promote the adaptive family functioning by teaching communication skills. Okay, so they will provide them the teaching communication skills to the family members. Okay, they will speak, they will talk more a lot, and they will find out the problem among the family members, those who having any problem, and the psychiatric nurse will be solve the problems. And delivering the psycho education, as I said, is they will give the psycho education to the family members. So that is about the family therapy unit. So next one is the Child psychiatric ward. Yes, child psychiatric. Yes, some of the child, so they may get the mental problem during their childhood. So those children will be under the special care. Okay, so there as a psychiatric staff or psychiatric nurse, how they will take care of the child, so that we are going to see here. Assessing for the biological and psychological needs of the child. Yes, what is that biological and psychological needs? Yes, so what is that? So biological needs means, as we know, so what are the things is needed the baby, right? So baby need food and baby want to play and all those things. Biological and psychological means or which is related to the this one. Okay, the mental functions. Okay, mental health. So that what is needed. So the nurse will be assessed first, and next one determine the child's strength and ability to develop a care plan according to the nurse's diagnosis. Okay, so they will determine the child's strength and abilities. How much will be the strength of the child and their abilities. Then these all the things will be this one find out the nurse. Then monitor the child developmental levels and initiate supportive interventions such as speech, language, occupational skills. Yes, they will monitor the child development skills. Okay, they will monitor the child development and they will provide some of the interventions. Speech, language and occupational skills. Okay, so those all the things they will, those are the therapy supportive intervention will give to the child. So some of the child it's not able to speak, they will give the speech therapy, right? Then language problem and occupational skills. Okay, so next one, provide safe therapeutic environment. Yes, they're absolutely right. So compared to the adult, child need a good environment. So here, child needs safe environment, therapeutic environment. And here, next one is a teach the child adaptive skills such as eating, dressing, grooming, toileting, everything. Okay, so they will teach the children how to do the adaptive, how to learn the adaptive skills, and they will teach them eating, dressing, grooming and toileting. And next one is the provide genetic counseling if needed. Okay, so some of the children they may have genetic problems, so because of that they will consult their parents. Okay, and they will, so as you know, when the mother will be pregnant, so if the baby the fetus is having the chance of what is that genetic problem, so they will defer the patient to the defer the mother to the genetic counseling. So they here in case of genetic problem they will refer the patient or they will provide the genetic counseling. Demonstrate and help the child to practice self-care skills. So they will demonstrate, saying like that eating, dressing, as that and all is same, and participate in various therapies like behavior and play therapy, expressive therapy. Okay, so they will participate the children in different kind of therapy. So that is the behavioral therapy and play therapy and expressive therapy. So this is all about the child psychiatric ward. So this is about the functions of psychiatric nurse in various settings in hospital. So this is only the few functions of the psychiatric nurse. Remaining I will be take the next class. Thank you for watching. Thank you all. Bye.